I'm Dr. Green with Seaview Orthopaedics. I'm an orthopedic surgeon that specializes in disorders of the foot and ankle. A bunion is a deformity of the hallux. The hallux is actually the great toe in the first ray. There are many different theories as to how bunions form, but regardless of how they form, they are a painful deformity that require attention. So mild bunions are a bunion that has a small bump at the medial eminence or that inside of the big toe joint. That can get a little bit red, especially when we wear inappropriate shoes or shoes that are just a little bit too tight up front. They generally don't hurt all the time, but they're indicative of a bunion that may get worse with time. Moderate bunion has a little bit more of a bump, definitely gets red a lot more, definitely hurts a lot more, and definitely doesn't fit into as many shoes as you generally want. A severe bunion is a bunion that has a large bump and the big toe generally starts twisting and can actually go under the second toe and lift the second toe up, causing a second hammer toe and other pathology at the level of the forefoot or other problems at the level of the front of the foot that can lead to shoe wear and activity limitations. So no one really knows why a bunion forms. There are different theories. There is definitely a genetic component because patients with a history of a bunion generally have a close relative that has a bunion as well, either a mother or a father, and they can trace their grandparents having ugly looking feet. So there is definitely a genetic component to it. Shoe wear can also be an issue. The American Orthopedic Foot and Ankle Society did a study a long time ago that showed about 88% of women wore inappropriate shoes. That is those high heel stilettos that the foot really doesn't fit into, but you jam them in anyway. And that can take a host that is susceptible or someone that does have a genetic history of a family with bunions and take them from having a relatively asymptomatic bunion and making that bunion larger and symptomatic. There is also a component of bunions that are congenital, where you will see teenagers who develop a symptomatic bunion that need to be treated. Treatment for a bunion starts off conservatively. Shoe wear modification, basically wearing appropriate shoes that are wide enough to fit the front of your foot. Also a little bit of activity modification, slowing up on running, switching to other exercise modalities that have less impact are definitely efficacious. The moment that a bunion really starts to hurt pretty much consistently, no matter what shoe you're in or what activity you're doing, is really when a bunion should be fixed surgically. Bunion surgery is very, very variable. There are actually over 100 different described bunion correction surgeries in the literature. Certain bunions require a certain type of surgery. Not all surgeries work for all bunions. When you have a mild bunion deformity that is symptomatic, we do a distal procedure or a procedure that's really close to the big toe joint. That's a little bit of an easier recovery, a little bit less painful, and will adequately realign the joint and prevent it from getting more arthritis as time goes on and allow you to have a narrower foot and fit into more shoe wear. Once you start getting into your bigger bunion deformities, a distal procedure, that is one at the big toe joint, really doesn't have enough correction power because you can't shift the bone over enough to get adequate correction. That's where we start looking at a more proximal or procedure a little bit higher up in the foot. We can do an osteotomy or cutting the bone at the level of the proximal first metatarsal, or we can do a procedure such as a lapidus, which is actually a joint fusion. A lot of people are coming in or have heard about a lapidus from several brands that are advertising a particular type of construct. Those brands are really just a brand name for a generic procedure called a lapidus, and that is the procedure of choice for correcting a large bunion. There are also procedures that you can do on the phalanx or the actual toe to help realign the foot, and all of them will adequately correct the bunion deformity. As long as the right procedure is chosen, all those will adequately treat a bunion deformity. The right time to fix a bunion is when the bunion starts to hurt pretty consistently. The moment the bunion starts to hurt consistently means that the joint is subluxed or out of place enough that it's starting to become arthritic. And I can make a bunion look very, very pretty and back to normal, but I can't do anything about the arthritis. And the more arthritic you are prior to surgery, the more pain you will still have after. So really, just as soon as that bunion starts to hurt is when you should see a doctor.